Most people who have knee replacement surgery recover well, but the reality is that some people do have complications that can cause permanent damage or even be life-threatening. Yet here's what's just as important to realize. Recognizing these warning signs and acting early can make all the difference. In this video, I'll go through the exact warning signs of 3 urgent complications that could threaten not only a patient's leg, but a patient's life, and what they can do in response. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained orthopedic surgeon who specializes in hip and knee replacements. The chance of having complications is unfortunately just a part of having surgery, but patients can lower the chance of some complications turning into disasters if they recognize warning signs and act. Let's start with one of the most serious complications: infection. Infection can lead to multiple additional surgeries, endanger the entire leg, and even spread elsewhere in the body, making it one of the most feared complications for both patients and surgeons alike. Before we dive in, I need to be clear that this video is for education only, not diagnosis and treatment. If you have concerns, contact your surgeon or go to the emergency room immediately. Now, back to infection. Infection occurs when small organisms like bacteria invade and multiply in the body, causing inflammation and tissue damage in the process. An infection after knee replacement can occur at the skin level, which we call a superficial infection, or it can go deeper and involve the actual joint and implant, which is called a periprosthetic joint infection, or PJI. Deep infections are much more serious, and they occur in about 1 to 2% of knee replacements. The risk of developing them is highest in the first several weeks after surgery. Patients should watch for drainage that comes from the wound that lasts more than 3 to 5 days after surgery, especially if it's white, yellow, or foul-smelling. They should also watch for increasing pain that's different from normal surgical pain, especially if it doesn't get better with rest. Moving the knee and putting weight on the leg usually increases pain beyond normal post-op pain. Increasing redness around the incision that spreads outwards, a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius, or worsening swelling around the knee can also be warning signs. The incision itself may also open in an area and form a deep path to the implant. Now, here's why making the diagnosis can be challenging. It's normal for the knee to be warm, swollen, and somewhat red after surgery. In fact, some swelling and warmth are expected for weeks and even months after surgery. A small amount of reddish drainage within the first 2 to 3 days after surgery is often normal, and a low-grade fever below 100.4 degrees Fahrenheit and 38 degrees Celsius within the first few days is often just the body's response to surgery. But here's what's different with infection. Drainage usually slows within the first 3 days, but drainage more than 3 to 5 days is a red flag. Normal post-op pain should gradually lessen week to week, on average, but infection pain often worsens, sometimes quickly and without clear reason. Normal incision redness stays close to the wound and fades with time, but infection redness spreads outward and often gets darker. Normal warmth is stable and gradually decreases over the weeks, but infection warmth intensifies with time. The key for these symptoms is trajectory. Are things getting better or worse? Patients who notice these signs should contact their surgeon immediately. The surgeon may order blood tests or draw fluid out of the knee for further testing. Like I mentioned earlier, infection can become a limb-threatening or life-threatening problem. While superficial infections can often be treated without surgery, deep periprosthetic infections often need surgery to be treated. As terrible as infection can be, the next complication has the potential to be just as serious or even worse. Blood clots form in about 1 to 2% of patients who have a knee replacement, and when they travel to the lungs, they can even be fatal. They can form in the deep veins of the leg, which we call a deep vein thrombosis or a DVT. DVTs after knee replacement usually occur in the calf, knee, or thigh. If a DVT travels to the lungs, that's called a pulmonary embolism or PE, and that can be life-threatening. After knee replacement surgery, blood is more prone to clotting due to the surgery itself, reduced mobility, and the body's inflammatory response. These factors make a type of cell in the blood called platelets stick together and form clots more easily. Once a clot forms, it can break loose and travel to the lungs in minutes or even seconds. The risk of clots is highest within the first 6 weeks after surgery, although the risk is elevated to some extent for about 12 weeks overall. Signs of a DVT include an increase in swelling in one leg, especially if it doesn't improve with elevation. Pitting edema in the legs can also occur, which is swelling that causes the skin to stay indented for a short time, even after pressure is released from it. New calf or thigh pain can also be a warning sign. In some people, the veins of the leg can seem more prominent than usual after a blood clot has formed. Signs of a PE include chest pain, shortness of breath, tachycardia, which is rapid heart rate, and hypoxemia, which is low oxygen levels in the blood. Here's what makes this challenging. Virtually everyone has some swelling after a knee replacement. On top of the knee being swollen, even the calf, ankle, and foot can be swollen during a normal recovery. That's because fluid in the body can accumulate there because of gravity, immobility, and changes in blood flow after surgery. But normal swelling after surgery usually peaks by the first week and then gradually improves. If swelling noticeably worsens, then that is a red flag, especially if elevating the leg doesn't help. The situation with pain is similar. Pain is a normal part of surgery, especially in the knee and thigh areas, but worsening pain in the thigh, calf, or back of the knee may be a sign of a DVT. Again, the timing tells the story. Are the symptoms getting better or getting worse? On the other hand, signs of a PE are more distinct. Chest pain is not normal after knee replacement. And although some breathlessness can occur during physical therapy, especially if the patient is deconditioned or out of shape, shortness of breath at rest is a warning sign. If a DVT is suspected, patients should call their surgeon's office immediately. An ultrasound is often used to diagnose a DVT. If the surgeon's office is unreachable or if a PE is suspected, patients should go to the emergency room for an immediate evaluation. Computed tomography or a CT scan is usually used to evaluate for a PE. The good news is that blood clots are often treatable if caught early, but they can be life-threatening if ignored. The last complication might seem like the least urgent, but wound problems can be the gateway to serious infection. Minor wound complications are actually pretty common at around 5 to 10% of patients, but more severe wound complications occur in about 1 to 2%. Wound complications range from minor issues like slowly healing scabs and small areas where the incision separates, to more serious complications like necrosis, where the skin actually dies. Surgeons take even minor wound complications seriously because poor wound healing can create an open pathway for bacteria, potentially leading to a deep infection. Patients should be aware of wound drainage that continues beyond the first 3 days after surgery. If the skin around the incision turns dark gray or black, it could mean that the tissue is dying and it needs to be evaluated. Patients should also watch for wound edges that separate or gap open, even if it's just a small area. Drainage in the first day or two and bruising throughout the leg are often completely normal after surgery. It's common for bruising to spread down the leg because of gravity. Normal skin around the incision might be pink or slightly red, and it's normal to have some dark-colored scabs on top of the incision within the first few weeks. But the skin itself typically shouldn't change into dark gray or black. And an incision that opens, especially if the opening grows with time, is not normal. The difference with wound problems is that they usually don't get better on their own, and they may actually get worse with time. For more minor issues like a few millimeters of the incision opening, it's still recommended that patients reach out to their surgeon for guidance. The surgeon may want to examine the wound in person and provide wound care instructions or antibiotics. For more serious problems like a large opening that forms a deep path or copious amounts of drainage, it's recommended to contact the surgeon immediately or go to the emergency room if they can't be reached. The goal is to treat this problem before it becomes a serious infection. These 3 complications account for some of the most important problems to be aware of after knee replacement. As you can tell, the recurring theme here is that early recognition and prompt treatment often lead to better outcomes. Remember, most people recover from knee replacement without any of these complications. But if a problem does occur, knowing these warning signs can prevent a minor issue from becoming a life-threatening emergency. The bottom line is, don't hesitate to contact your surgeon if something doesn't seem right. We'd much rather see you and have it be nothing than miss something important. Next, I'll release a video on 3 mobility warning signs after knee replacement, including weakness, stiffness, and foot drop, all of which can significantly impact your recovery. Once that video is ready, I'll link it on this screen. If you learned something in this video, click the like button so I know it helped, and leave a comment on what you'd like to learn about in the future. Stay well, and I'll see you in the next video.